Let's say the topic delegation. What is delegation? Delegation is something, an assignment we are giving to the other authorized person to carry out. Example, whenever we will give a work was being assigned under us, we will share it with an the same job description or the one who can be handle it to them is an delegation. Example, it will be like sharing the work for crash card checking, and the other one is like it should be always maintained from the hospital policy and protocols. Elements of delegation, there are three elements. First one is responsibility, second one is authority, and the third is accountability. What is responsibility? We need to make sure the work whomever we are giving, they are responsible enough, they are eligible enough to complete that work as it needs to be done. Authority, the one who is being delegating to this work needs to have the authority to take over the work on them. Accountability, we can't promise always the work will be done in a 100% perfect way. So sometimes whenever it is going out of our hands, we need to make sure that it was being done, error or the better things is being done by the person. They need to take their accountability. Purposes of delegation, we need to make sure everyone's work is equally distributed. We need to make a routine work completely done. For example, is like medication checking, crash card checking, checking for the isolation room negative pressures, working of the equipments, all these things. For problem solving, to reduce the workload, that the nurse manager emphasize the others' works and to increase the capacity of the workers who are working under the department, time saving and to improve the quality. Types of delegation, there are two types, formal and informal. Formal delegations which are being done in a professional and in the working environment. Informal delegation, it is done in a household chores. Example is like the mother is distributing the household chores between the kids and the family members. Formal delegation example like making the staff to complete the working task and asking the nursing assistant to complete the vital signs of the patients, intake output to be closed, removing the urine from the urine bag, all these things. Delegation errors are like under delegating, over delegating, and improper delegating. Under delegating, example, the nurse is capable to complete a charge nurse responsibilities, but we are delegating her something called as like only to complete the documentations and not giving her a complete work, that is under delegating. Over delegating might be a new nurse or a new graduate who is been in the department or giving her a big authority. Example, infection control link or delegating her to be a charge nurse, all this. Improper delegating also comes like when the person is not ready to take the authority or the person is not ready to take accountability, we will delegating that person a improper work where they cannot able to finish it out. So that is improper delegating. Ethical and legal issues. In ethical and legal issues, we have assault, malpractice, negligence, battery, false imprisonment, defamation, all these things. Assault, it can be verbal threatening. Malpractice, doing mistakes and blaming on others. Negligence, not giving a complete care to the patient. Battery, like pinching, punching, slapping, all these things. False imprisonment, restricting the freedom of the patient relatives. Might be you are not happy with the relatives and you are making sure whenever it is a time to visitors are not allowing the visitors to visit the patient. See, we can be sometimes not happy with some of the patient relatives, or we will be tired of their questions, everything. But we need to make sure that they are the family members, they are the loved ones or someone. We should not restrict their timing. So this comes for the false imprisonment. And defamation, making the person's reputation decreased. You and your colleague might be not in a good terms. In front of the relatives, we need to maintain our dignity. Not that in front of the relatives or in front of the any authorized person, multidisciplinary team, we should not say anything wrong about the person. That is defamation. It can be verbal, slander, or it can be written, libel. Someone can be raising the complaint against them, all these things. Ethics, autonomy, we need to think about our happiness and our freedom. Beneficence and non-maleficence is always like we are carrying someone with us for the responsibility. Confidentiality, we need to always maintain the confidentiality of a patient, of the working environment, everything. Veracity and accountability, we want to be make sure whatever is done by us, we need to accept it if it goes in a very good manner or in a not acceptable manner. Functions of registered nurse. The registered nurse will be writing the nursing diagnosis, handling the patient, giving medication, doing assessment, evaluation, health education, and teaching and training the licensed practiced nurse and VN, vocational nurse, everyone. What is the delegations of licensed practice nurse? Monitoring the vital signs, changing dressing, inserting catheters, and taking patient history, administering medications, all those things. What about the unlicensed assistant professionals? They will be taking vital signs, transporting the patient, intake output monitoring, range of motion exercise, helping the patient in a personal and clinical information, behavioral changing to be documented and report to the nurse, registered nurse. Nursing manager, what the nursing manager will do, they will organize the human resource, they will organize the duties, they will delegate the works, and they need to maintain the quality of the care and aligning with the goals with hospital. Please mind, this is a recorded class, so if you have any doubts, kindly contact us. Thank you.